Primary care issues in our community relate a lot to access to care. So there are insufficient GPs to provide care to all the patients the way things stand at the moment, at least. That relates to things like GP retirements and the increased need for care in an aging and more complex population.
We have several strategies in the Comox Valley for addressing the issue of access. In particular, we're aiming to recruit more doctors. We'll address the residents as they come out of programs and try and recruit them to our community. We look at return of service GPs who are training at St. Paul's and other places and try and get them into our community. And we advertise widely for new doctors. We're also trying some strategies to place difficult to attach patients in established practices, and in fact we've set up a clinic for difficult to attach patients as an independent entity to deal with them by some doctors who volunteer to do that. There are many things we'd like to see as a change in healthcare overall, and they include things like reducing the wait for services such as surgery in particular, but also the wait for accessing ourselves in primary care. So I think we need more. We need to change how primary care is provided. We need to move to team-based care, and we need to be more accessible to patients when they become sick.
What I'm personally excited about with the GP for Me program is that it's an opportunity for us in primary care planning to step back and examine what issues we face and try and craft some local solutions to try and address those issues as well as we can. It's also a great opportunity to work with other agency partners such as health authorities, the GPSC, and the Division of Family Practice. My vision for healthcare in the future on the more broad level is that the model of care would change from a current one doctor, one patient episodic access model to something where people have access to a team of professionals working collaboratively together and ultimately being able to provide more service to more people on a more sustainable way.
My vision for healthcare changes in our community would involve some change in the way primary care is provided so that there was more access to care and there were fewer unattached or no unattached patients ideally.